Good evening. The push to vaccinate America about to enter a new phase. Millions of Americans could soon be eligible for either a third shot or a booster. The CDC says 180 million Americans are fully vaccinated. That's about 54% of the total U.S. population. That number higher in Erie County, the full vaccination rate just shy of 60%. Booster shots could be available in just a matter of weeks. Natalie Fahmy looks at who will likely be first in line and the one hiccup that is not expected to happen this time around.
J&J is going to take a little longer because they got approved later.
Dr. Nancy Nielsen says a study that tests 3 different doses of Johnson & Johnson booster shots is ongoing. She says it's close to being complete, but it will take time after it's submitted to the FDA.
Let's wait a little while. There's nothing urgent about this.
To put the timing in perspective, Pfizer submitted their data to the FDA seeking booster approval for those 16 and older exactly 1 month ago. The FDA and CDC will meet on Friday to discuss the data, and a recommendation can be expected sometime next week. So, who will be eligible?
They may say, well, we'll only do it for people over 60 or over 50, in addition to the immunocompromised.
Dr. Nielsen says booster eligibility could follow the same pattern as vaccine eligibility earlier this year, with one key difference. Vaccine supply problems that popped up in the early stages of rollout are not anticipated once boosters are approved.
They assure me that there will not be a supply problem, that they have been ramping up.
But why do we need booster shots? Dr. Nielsen says after getting any vaccine, antibodies drop off over time. She says a yearly COVID-19 dose was a consideration, but is not necessary right now.
This virus mutates also, but its mutations haven't to date escaped the protection of vaccines.
Now, for those of you with an Excelsior pass, you may have realized they expire about a year after getting vaccinated. But as of now, that doesn't mean getting another shot. Renewing your pass is as easy as going online and resubmitting your information.
The Excelsior pass will be extended as long as it seems scientifically true that you're protected. That's the whole point.
A state health department study shows that over time, vaccine effectiveness against infection does not decrease by a significant amount. As long as that stays true, it's likely you won't need another dose to renew your pass.
What they're trying to do is respond to the science. How long do we know those antibodies are going to be protective?
Pfizer is expected to submit data for children ages 5 to 11 by the start of October, and for toddlers 6 months to 5 years by the end of October.
It's coming. It's coming fairly quickly.
In Buffalo, Natalie Fahmy, 7 Eyewitness News.